Now to another happy ending. Vince had an infection in his brain. The prognosis was not good until Dr. Brent Morgan at the Texas Institute of Spine and Neurosurgery stepped in and saved his life.
Well, the Apollo system is a unique device that we use to aspirate intracerebral hemorrhages. Basically, it's an endoscopic procedure. We place an endoscope under guidance, sort of like GPS guidance. We place into the bleeding in the brain. And then we use this Apollo device to aspirate or suction out the hematoma. So it's a small hole and a small approach, and so we can do it very minimally invasively. According to the company, they said that we were the first hospital and I was the first doctor in Texas to do that procedure.
I had meningitis, bacteria infection, and it was horrible. It was terrible. I was snow skiing, severe headaches. I thought it was the altitude. Then my memory stopped recording, and what I was told was that I had severe headaches and I wasn't thinking straight, and I was rushed to the hospital, and I ended up in intensive care, and Dr. Morgan showed up.
Vince was a patient that we had at the hospital actually up here in McKinney. He was found to have an infection in his fluid spaces in the ventricles in the brain, which is a lot of times a lethal problem. I had the idea of potentially using this Apollo device, which we use to aspirate bleeding, and I thought, why couldn't it aspirate out infectious process? And so we transferred him down to Plano, where we have this device, and we used the procedure to remove the infection from his brain, and it was extremely effective. The pre and post-op scans showed that we'd removed most of the active infection in there, and it completely turned his course around. So that was the first time nationwide anybody's used it for that specific indication. Luckily, that's not a very common problem, but in this patient's life, I really believe it saved his life because we were able to aspirate it out and get rid of the infection.
Dr. Morgan, he's just he's very knowledgeable, yet he's very friendly. Some doctors are not good with patients. He is. He's just magnificent.
That's what we do. We try to do good things and turn patients' outcomes around. And somebody that probably was not going to survive their injury, and now he's surviving and he's functional. As I understand, he's back to work and doing a lot of things that he did before. I mean, that's exciting.
You know, people who have this kind of bleed, they press on the brain and then it herniates, and most of the time they have death. Even if they recover, they have weakness, they have problem with the speech, they couldn't talk, they couldn't concentrate, focus, and they have basically disabled. But now he is walking, talking. If he doesn't tell anybody, you can even say that he had this kind of procedure.
I feel like I'm a dead man celebrating life, and I'm happy about that. And Dr. Morgan's Apollo procedure saved my life.